getting started. And I also want to thank you all for making time to join the Community of Practice Resource Team discussion today, where we have a rare opportunity to be self-reflexive, look at our own work, and focus on trying to distill what are we learning about advancing our scale-up work in the COVID context. Certainly our personal lives and our work has been transformed by our new situation. And for many of us who are accustomed to traveling internationally for our collaborations to work in very hands-on ways with governments, with NGOs, trying to scale up family planning, reproductive health, and other kinds of interventions, that travel was a big part of our work. And if you're like me, you're constantly working to ensure that your work can continue in productive ways, and that your joint work can advance during the course of this pandemic. So when we were thinking ahead to this meeting, we thought it would be a good idea to try to collectively share and draw these lessons out from what's happening, what insights we're gaining for how to keep the scaling up ball moving forward. And so I am inviting you all to share your learning. And although we've lined up two initiatives, I should say, to share in greater depth today, we would like that to be a dialogue. And although they'll present, we have time after each presenter to share for other resource team members to share some of your work and insights that arose for you during the remarks. And so I wanted to, it was an idea that I had last week or a few days ago maybe, to share in an effort to get a pulse on the meeting, to try to do a quick poll. And I know that these can be annoying, but hopefully this one will be sometimes fun. They can be thought-provoking, and we hope to really channel the results of the poll into the discussion. So without further ado, as a warm-up, I'm asking Elida to pop the poll up on the screen, and I'm going to record the results. And so I'm going to ask everybody, I'll read this aloud. To what extent, the first question, to what extent do you believe your scale-up work has been slowed in the new coronavirus context? And then after you click submit, and we'll move to the next one. And we're going to do it quickly. So Elida, go ahead and go to the next question if you would. There's the results, good. And the second question is, what is your level of confidence that your scale-up work can continue to meet your stated goals in the time frame initially planned? Okay, Elida, if you'd give us the results. Okay. And the third question, the final question, are you experiencing some positive developments in your scale-up work as a result of the adjustments you've had to make? Okay, Elida, probably got enough. Good, that's probably what I expected. Great. Okay, so now if we could pop the agenda for today up on the screen. So I'm sorry I didn't send an agenda around in advance of the meeting, but of course, as I was saying, we want to roll the results of the poll and just how everyone is thinking about their work into the entire discussion today. So But our agenda is to basically do a deep dive technical discussion with a couple of initiatives. One is with Dr. Sada Danmusa, who we have heard from before in the resource team. And the other is an exciting initiative underway in Uganda. And I'm going to, of course, introduce both of these more. But before I do that, I want to also highlight in the agenda that there is time for everybody to contribute. I didn't hear from anyone per se that wanted to contribute to this discussion, but I hope that everybody will share what you all are learning. And to that end, I want to remind you of the 3 thought questions that we articulated for today's session, so that as you hear from the speakers and engage in dialogue, that you keep these in mind. So the first one was, what are we learning about adapting the scale up of family planning and reproductive health interventions, or whatever else you're working on during the COVID crisis? The second one is, what are we learning about ensuring that family planning and reproductive health interventions are not neglected during the pandemic? And the third question is, what key lessons have we learned about using digital communications platforms to advance our scale-up work with key partners and relevant stakeholders? So if you'll keep those in mind, that would be great. And think about how you answer those, how our speakers are answering those, and what is that all raising for us collectively as a resource team on Scale Up. Okay, so the 2 initiatives that we're going to benefit from hearing today, the first one is, as I said, Dr. Sada Danmusa from MidSpace in Nigeria, who some of you will remember was with us in the October 2019 resource team meeting, where he was sharing the very innovative, creative ways that his organization has been collaborating with national and state ministries of health in Nigeria, using the TRACK platform. And we heard about that in some detail. I hope you'll go back to the recording of that session if you haven't heard it before, because it's very enlightening. And then most recently, the Expanded Secretariat did an interview with Dr. Sada several weeks into the pandemic to hear what kinds of adjustments that he and his team are making in their work with the states. And there was a lot of very interesting and important insights into how to work productively. And since then, we've had the benefit of a couple further conversations, and we thought that you may also wish to hear how MSpace is adjusting their work. So that was the impetus for inviting Dr. Sada back, and we're really pleased he's able to find the time to be with us. The second presentation is one I don't think you've heard about necessarily in this context much. And this is called the Real Fathers Initiative. And this is a project that is scaling up a successfully tested violence prevention model and in Uganda. And it's been underway for several months. And the initiative is reaching the stage of developing a scaling up strategy when the coronavirus pandemic unfolded. So their plan had been to use the expanded WHO 9-step approach, and now they are figuring out how to try to make adjustments to plan and conduct that workshop effort via distance with people who are in several different parts of Uganda. And so we wanted to hear about how they are adjusting, because it's a very hands-on application of Scale Up, and we want to learn more. So I will give proper bio sketches when folks are talking, but I wanted to highlight that during the presentations, if you need a clarification on any question that one of the speakers is asking, you can interject, you can raise your hand. And we also have, of course, the chat box, which everyone is familiar with by now. And, but of course, after they're done with their remarks, we will have a dialogue about what they've presented, what your insights are. And so that is, of course, another place to really hash through. So you can wave your hand, and you can also use there's a couple different features in Zoom to get attention of the speaker or the organizers, which I should introduce Elida Orankoy, who's co-organizing this session with me. She will now, before we start, tell us a little bit about some Zoom etiquette for the session. So Elida, if you don't mind.
Hi, everyone. Thank you so much for joining us today. My name is Elida Orankoy, and I'm the Communications Coordinator for E2A. For today's meeting, we ask that you please stay muted if you're not talking. If you forget, that's no problem, but I might step in and mute you. Also, in order to conserve bandwidth, we ask that you stay off video for now. When we get to the discussion portion, you can feel free to turn it on while you're speaking if you're so inclined. Also, I'd like to use this as an opportunity to quickly plug the new IBP Exchange platform, which has replaced the Knowledge Gateway site. Last week, you should have received an email from Laura inviting you to sign up for IBP Exchange. So if you haven't done so already, we strongly encourage you to register. In addition to our COP on Scale Up, you can also find a range of other COPs and working groups that might be of interest to your work. If you didn't get the email or are having trouble registering or have any other questions at all, you can feel free to reach out to me after this meeting. Thanks very much.
Great. Thank you, Elida. And people should have your contact info from some of the messages that have gone over, right? And if not, you can always reach out to me. So without further ado, I want to introduce Dr. Sada Danmusa, who is a physician with postgraduate training in public health and strategy management. He is the founder and serves as the executive director of MidSpace, a Nigerian NGO that leads the Nigeria Technical Support Unit. And Dr. Sada has been working for well over 20 years on health leadership and management experience in Nigeria and other African nations. His main interest is supporting efficient delivery of quality public primary health care services at scale. And Dr. Don Musa has successfully led implementation of several health programs in maternal, newborn, and child health, family planning, and HIV. And over the last 6 years has been providing support to Nigeria's national and state level governments to plan, deliver, and coordinate reproductive health and family planning programs at scale. Currently supported by the Bill and Melinda Gates Foundation, he has led efforts to develop and roll out the National Family Planning Blueprint, several state level costed implementation plans, and the National DMPA SC Accelerated Introduction and Scale Up Plan. So over to you, Dr. Sada, and thank you so much for taking time to join us.
Thank you very much, Laura. I will want to put up my video because my network keeps on fluctuating. I don't know if that's okay for you, Laura, or if you want me to put it.
Sada, let's not impose on the network too much. It's most important we hear you.
Right. Okay, thank you very much. So good morning and afternoon, everyone. As Laura introduced me, my name is Dr. Sada, and I'm going to be speaking on how we are trying to advance scale-up of family planning services in the face of the COVID-19 situation. She mentioned basically what we do, but I think let me just take a minute to say that our main role is really to support government to better deliver a scale of family planning services. And this goes to both national and state level, but we are presently only working with about 13 states of the 36 states of the Federation, but we are expanding to the others, and I will discuss our plan for expansion as we move in. So we do our work by trying to strengthen capacity for three major things. We wanted to strengthen capacity of the government to be conducting more consultative planning, basically because we know that decisions that are reached through consultations are more likely to be accounted for. We also support them by ensuring we support their technical delivery, that they are delivering family planning interventions better. And we do this by working with the middle level managers through a technical advisor that we embed within the government institutions. And the third thing we do is we try to facilitate performance accountability across the whole system. We do this by strengthening data used for evidence decision making. And I will discuss how we do that. And perhaps in the interest of time, if I'm not able to go deep into what we do, kindly just note it down so that during the discussion I can explain further. So our key modus operandi, which we term as working from behind, include, as I mentioned earlier, embedding a technical advisor to be working continuously on a day-to-day basis with mid-level officers within the ministries and within other agencies of government. The meaning of the working from behind is that is basically, or she's basically just facilitating what they do so that they learn by doing. The other method we use is really what Laura talked about, which we call the track. It means transparency, accountability, and capacity platform. This one we have, we cluster states within the geopolitical zone and have them to be meeting on a regular basis and looking at data from their state using the National Health Information Management System and analyzing what progress they are making and trying to come up with what are the key issues, what are the key challenges, what are the key bottlenecks, and then agreeing on what needs to be done. But importantly, not living there until they make commitment to address some key issues before the next meeting, which is usually on quarterly basis. Now the track is not mid-level managers, they are top leadership of the government agencies. So this is basically what we do on a quarterly basis. We come together with them. In this, we partner with some key organizations. Track 20 has been a big partner on the data bit. Pathfinder's Advanced Family Planning Program has been our partner on the advocacy bit, while ExpandNet has been our partner in coming up with scale-up strategy and how we look at what is happening and we alter how we support scale-up within those geographies. So the purpose of this little talk is just to give you kind of a glimpse of how we are working to continue to advance our agenda of supporting government to scale up family planning services within this context of the COVID-19 pandemic. Perchance we will learn one or two things and you can expand what we do and tell us where you think we need to change or where you think we need to improve. So starting with the central message, what I'm trying to communicate really is that despite the COVID-19 situation, we have been able to continue our work of supporting this government. And in fact, we are even confident that we will implement our expansion plan to cover the whole country. Now, the country is composed of 36 states with the federal territory, which are divided into 6 geopolitical zones of between 6 and 7, each of the zones. So we are only in 2 now, which covers about 13 states, but we also work with the federal level and the federal capital territory. But we are also planning to get into this other 4 geopolitical zones. So now, as an additional background, how we look at the COVID situation and how it affects what we do with the government and the FE scale-up field in general, is that we do know that ab initio, we anticipate that there will be contraceptive supply issues right from the beginning. We know that with the closure of manufacturing, some big manufacturing plants that supply the country, with delays in shipment that is happening, all across, and the delay in getting ships into the country, and with interruption in distribution, even within the country because of lockdown and movement restriction, we're certain that there is going to be contraceptive supply issues, which will affect family planning services. We also know that access to services will be hampered, basically because as states are closing, we know that facilities were also closing because resources are being diverted from state government to fight COVID. But importantly, we also know that facilities will be rejecting, and they have been rejecting right from the first week of the first week of this pandemic. Facilities have been rejecting patients basically because of fear of the COVID situation, the COVID infection. So we also do know that demand for services will be reduced because women will be prioritizing for essential services. We do know that a lot of information, a lot of literature, especially from the Ebola outbreak, that you realize when there is a situation that imposes people to stay at home, resources get down, non-essential services are deprioritized. So we do know that family planning will fall into that. So what we wanted to do in view of all of this is to make sure that we support the government to continue to coordinate implementation activities so that activities don't slow down, which we definitely know they will. We also wanted to support the government to ensure that the situation does not significantly reduce service delivery or service access and service provision. And we also wanted to support the government to see that it does not dwell on its longer term scale of efforts. For many years, we have been working on strategies for scale up, which is looking at a very longer term. And we are at a very particular situation where AP 2020 is ending and we need to strategize. So we didn't want a situation where this situation has affected that kind of long-term view of the government. Now, what I must say is that because of the way we work, the adaptable nature of our work, we're able to continue to support this AP scale-up that we do with the government. And we even expand to support the government to in some way address the COVID-19 situation. Not fully address it, but basically to support the response that the government is very much interested in doing. The reality is that for most of the governments, especially at the state level, if you're not contributing to their response to COVID-19 situation, you will see significant loss of interest in what we do. So we had to quickly adapt. So what is it that we did? What are those key shifts and key changes that we're able to introduce to allow us to continue what we're doing? One thing is that we, up initial, realized that the way the government is working will have to change. The government have been very much used to face-to-face meetings, use of hard copies, and not working remotely. And if someone is going on leave, it's almost, if someone is traveling rather for work, it's almost he's incommunicado, you cannot reach him. But we know that will have to change because of the lockdown and because the government will have to continue to work. So we supported them with some IT infrastructure, but importantly, also support them to build their capacity to do this kind of remote meetings, remote work, and how they shift their paradigm toward using more of electronic documents rather than having the hard copy that they will have to be signing. We also look at what we are doing. Our main mechanism, which I said earlier on, the track mechanism. So we had to also change to do that remotely. And of course, other small engagement that we do with the government, we have to make it remotely so that we protect ourselves and the government itself. So the way we adapted the track meetings, which initially what we do is to bring leaders together in a place for about 3 or 4 days to know themselves, to speak with themselves, to share learning, and that physical touch, which we found very, very useful in the leaders knowing themselves and becoming more closer across the states and learning and sharing information. That is not available now. So we realized that we have to, do a lot of preparation and a lot of engagement, more than we were doing prior to the COVID situation. Part of what we had to do was to create WhatsApp group for each of the states, and we assigned a facilitator from us that will be working with the states to look at the data, to engage them more and prepare before the meeting. And we had some platforms where we share electronic documents amongst all of us, so that when we look at, once you get into that, you will now be able to see any new material that has been shared. But we also work on more on trying to shift the paradigm. The nature of how the government sees service delivery is more of getting to the facilities, providing services, but with all the challenges that the situation brought out, we realized that we have to support the government to shift its mentality into more of a model that delivers services more closer to the communities. And in that sense, we were able to get, to get the governments to start adopting the World Health Organization self-care approaches, which is more like moving the services toward the people. And we also try to emphasize the tax shifting components of the tax sharing and shifting policy. We also try to ensure that we get the government to think toward reviewing the service provision and training protocols, so that service providers that are down the line will now be able to see that things have changed and we need to incorporate how we deliver services in this way and that way. Some of the examples of that will be, the training curriculum for both clinicians, nurses, and midwives, but also the training curriculum for community health officers and the community health extension workers. Even though those are basically community delivery mechanisms, over the years, we noted that their training curriculum has been more about how they deliver service in facilities, and we feel that that needs to change. And we also supported the supply chain issues. We supported the governments to develop a small plan to be able to address the situation, to be able to monitor where stocks are, to be able to be agile in how they get commodities moved from one state to the other, or one locality to the other, once they are able to monitor that it is, it is getting short there, but it is more there. So some kind of mechanism to do a reverse logistics. We also supported them to engage donors, because what we also noticed is that there has been a situation where commodity resources for commodities was short because of recent budget issues that we have had. And the government was trying to address that when this situation came. And then we realized there is a need to ensure some commodities are made more available. So we supported the government to engage donors, and it is proving fruitful, because there has been discussion of how they will get more resources to purchase commodities, even if outside the usual procurement system that they do have. And I think importantly also, we're able to get the government to kind of shift its plan for strategizing was 2020 to start now. The initial plan was that the government wanted to wait until the end of, until within the fourth quarter to be able to strategize, because they are still collecting data. They wanted to see what is happening up to the end of the situation before they change, before they start strategizing. But we've been working with them to get them to change that mindset. But the COVID situation brought about a very important opportunity to get them to start discussing on post-EP 2020 FE strategies. So in summary, this is basically what we've been able to do. In terms of how we see the lessons that we're able to, they allow us to be able to do this, we were able to come up with some 3 things that we think are really useful, and they are key things if others can adopt them. One of them is the principle that I talk about, which we work from behind, is to continuously, one principle of that is to continuously work with the government by challenging the leaders. You not being in the front, the leaders are being at the forefront, but bringing more and more challenges so that as they address some challenges, the key officers do learn more. And we try to do that in this particular situation and show them that the COVID situation is really more of an opportunity to demonstrate leadership. So for most of those policies that we've been able to change, guidelines or the training protocols, were just achieved by asking, so how do we adapt such and such to this particular situation? Then the government said that, okay, because this is where we are, we think this is what we need to achieve as an outcome. So we need to alter this, or we need to develop this kind of guideline here and there. So we were able to do that by just focusing on that principle of saying that, okay, the government people needs to be challenged continuously. One other way we were able to do that is our mechanism is really expandable. Basically, if you notice what we do focus on is how do you consult more, with all the others. If you know the situation in most of our governments is that even within the government, officers at different levels don't usually work together. If you have an M&E officer, his only engagement with the director is when he is asked to bring some information. But we wanted to change that, so we come up with the consultative planning idea. But beyond just within the government, it's also consulting with the CSOs, consulting with other private sector, consulting with government from other states. So I'll be able to look at what the issues are and then come to a decision that is workable. Now, we do know that that has helped us in addressing or in adding the COVID-19 situation to the family planning work we do. So if you facilitate how they use data for decision making for family planning, that also comes in handy with how they address COVID-19 situation. Another example is also the consultative mechanism also enable us to really use, to review the information and take decision regarding the COVID situation. So when you are sitting down and you see this state is having less number of people tested than this state, you can now be able to get them to consult, to ask, and to understand how they are being able to get more test kits or what mechanism they are using to be doing better and better testing. So that consultation also was a very good example in how our expendable mechanism was able to support the COVID-19 situation in addition to family planning. And just to add, we've also in the plan to add some other MSCH services, because we kept on getting the leaders, because they are top leaders in their states, we kept on getting them to ask, look, we need to include other things just beyond family planning. We also note one key thing is that the public officials are more open for guidance and to advice, because basically they are facing entirely new situations. And we're able to use this opportunity now to expand on what we're doing, to expand on the questions we're asking. So beyond just family planning or beyond just looking at the data that you have, we also tend to look at, so what is happening with the other government agencies? What is happening in finance? What is happening in your relationship with getting money from finance, and then they're getting more and more open and involving us in some of those key decisions in how they engage with the others. We do understand that it started basically as, or is primarily a public health issue, but it's really affecting all the other sectors. And we feel this is an important way to expand the thinking of the family planning and health leaders to be able to see how they can collaborate across the sectors. So in the limited time I have, this is what I can be able to summarize and how we do the work. I am open to questions and additional information if the need arises. Thank you very much.
Thank you, Dr. Sada, for sharing so many interesting developments in your work, the challenges as well as opportunities to ensure collaboration across different levels of government within a state as well as across states, and also how you're also folding into supporting government with the COVID response is very exciting. So let me open the floor to anybody who would like to ask Dr. Sada some questions. Oh, I forgot to turn my video on. Not good modeling. So if you would like to ask a question to Dr. Sada, you should feel free to use your video. And you can make comments also. You don't have to point them directly. If there was issues that Dr. Sada raised that you would like to share about similarities and differences from your own learning, the floor is open. So please just unmute. I think you can raise your hand and we can call on you, but really the floor is open. Anyone who wants to speak, go ahead. There is one question that Ramadan Kurunda had entered here, so I can also offer that. Dr. Sada, Ramadan is saying, I hope I didn't miss it, but did you engage private sector, drug shops, pharmacies, and clinics in the scale up? If so, how was this done and what are key success factors for this?
Okay, yeah, so basically we do that, but and not directly, basically remotely, basically because we work with the government and we support their planning. So our engagement with the drug shops, the pharmacies, and the clinics, specifically the private sector, is how we work with government to engage with them. One key example is, as this started, we have agreed with the government that they need to revise their private sector engagement strategies. They need to revise the tax shifting and tax sharing policy, or not revise, but emphasize on some aspects where they reach out to ensure that they shift the tax to some key providers, even within the private sector. One important effort is the work that we do with other organizations in supporting patent proprietary medical vendors, where those are really the drug shops in Nigeria. So we're trying to get the tax shifting policy to allow them to stock and provide all range of contraceptive methods. So we also accelerated that policy because of this COVID situation and because of the opportunity that it provided for the government to see how do we move services more to the communities. But in terms of getting to the, getting to the drug shops, because we don't do service delivery down at the lower level, we only stop at the government, the leadership level, and we support how they engage, how they expand and include this important stakeholders.
Oops, sorry, I was muted. Anybody else have a question or comment? I see Sarah Jane has submitted one. Dr. Sada, she's asking, could you talk about the challenges of scaling to new geopolitical zones amid COVID, as opposed to strengthening your work with existing partners in the current geopolitical zones? How would you distinguish between these two tasks?
Okay, yes, this is very important question. We've had a lot of discussion with our team and the government partners and even the donors. And the key thing we do say is that there are challenges and it won't be simple, but we see this as an opportunity to be able to get to these states, to get to these other zones in a more smoother and cheaper way. One advantage that we have been able to see in terms of the COVID situation is that it has opened up the government to be more open to remote work, to online meetings, to providing their time to do things on their own. And we feel this is a very good opportunity to expand it to these other states using that mechanism. But importantly also, over the years that we have had the current 2 tracks, we have learned a lot of things that we think expanding it to other situations, to other geographic location is much, much easier. We have seen all the challenges, we have seen most of the difficulties, and we think what we are just going to be doing now is replication. We know who to engage, how to engage the key stakeholders, and what to start with. And we feel this is a very, very good opportunity to expand it. And we have battled initially with how do you sustain this situation? How do you sustain this particular mechanism that you are supporting on a quarterly basis? But the COVID situation that has opened up more opportunities to do this remotely has given us a very important, benefit to be able to introduce this. And once we're able to do it and concretize how we do it on a continuous basis, we know this is now sustainable because it is going to be much cheaper, and the states will ab initio be taking the leadership in coordinating this. But we think this is going to be very, very useful. Now, in terms of the 2 situations, how we distinguish between these 2 tasks, what we are doing is our engagement with the current platforms that we are working. We look at it more of vertical, deeper engagement, which includes adding other services, adding MSCH, adding child survival indicators to track and how you pick bottlenecks in that, because this is the need of the leaders. But we see this other one as more of a horizontal expansion, because we are just going in there with family planning for now, wanting to make sure that family planning services have been, the scale-up has continued, and we have gotten the leaders to be doing all of these methods and to scale up new and important good practices in family planning before we now come to do a deeper, more vertical expansion where we get these other services to this new tract. I hope this is, understandable.
Yeah, very, very helpful, Dr. Sada. Yes, thank you.
Laura,
So,
one comment.
we can't hear you very well. Who's speaking? Sorry, I do.
Hi, it's Martha Brady from PATH. Can you hear me or no?
Somewhat. Dr. Sada, can you hear Martha okay?
I will try another mechanism.
Yeah, she's breaking. I didn't hear very well. Maybe if it's
Can you hear
Yes,
better
better.
now? Sorry,
Good. Yes.
I tried to raise my hand in the chat, but couldn't figure out how. So just hello. Thank you very much for that, Dr. Sada. My name is Martha Brady. I'm the Director of Sexual and Reproductive Health at PATH. And just two quick points and maybe a question. PATH institutionally is very involved in the COVID response in many countries, and we are closely tracking both in Senegal and several places that we work closely with, both the disruption to supply chains, as you mentioned, as well as the disruption to services. Chief among them are the EPI, the immunization programs, the maternity care, and then sexual reproductive health. All of those we're sort of looking at and seeing what's happening there, and have a lot of, and also we house the Reproductive Health Supplies Coalition, which is very much trying to track commodity supply chains across many countries. But one point that I would like to make, we also are actually very engaged in the DMPA-SC self-injection work in several countries. And in Uganda, for example, we are everywhere we can. We are switching our training to virtual training. That's one very specific example we're doing within the COVID era. And frankly, can you hear me?
Yes. Keep going.
Sorry. Oh, sorry. I thought I got frozen. So we have working much more closely with our digital health program to actually make as much training online and virtual trainings as possible, which we think is extremely important during COVID, but frankly beyond that. So we're looking at the initial COVID response and recovery, because there will be a recovery, and sort of the frameworks for, as we call it, building back better. So I think that intersection of where digital applications can align with both sexual reproductive health commodities as well as services is something we're working very closely and very intensely on right now. And the other small piece of that, I'll just leave that it's here, won't go into great details, has to do with a real focus towards more self-care, which allows a better use, individuals being able to have more agency and action to take many decisions on their own with health within the context of primary health care. So I'll just leave it at that for the moment, but I thought it related to the topic.
Yes, definitely, Martha. Thank you so much for sharing that. So I do have one more question I'm going to take for Dr. Sada, which is Trish McDonald from USAID. How important is it for the government and service providers to acknowledge that family planning is an essential service in order for them to continue with the scale up and sustainability of FP during COVID? So Sada, that would be great if you could just address that, and then we better turn to our other speakers.
Yes, I think this is really a very important point. And, part of what we keep on doing is the fact that what we will see post-COVID, regarding family planning, disruption of family planning, and outcomes of that disruption in terms of unwanted pregnancies is definitely going to be mind-boggling if we don't do what we are supposed to do now. And we kept on pushing and getting the government to understand that. In the large cases, the key thing is that the government we work with are really also in family planning, and how they will now engage the other aspect of their sectors. For example, if you have a presidential task force that is handling COVID, and they feel, the ministers within there feel that a lot of money should leave family planning and go to COVID, how do you, as a government, be able to address that? Now, beyond that, the other aspect of that is the people themselves, not just the service providers, but the women themselves, that situation comes within household where they will have to prioritize in terms of the resources, especially when in many situations, in many communities, even though we say family planning is free, they will have to put in some money. Now, if resources get scarce within the family, they deprioritize family planning, obviously for food and other things, but in most cases, businesses have gone down. So what we keep on talking with the government is those situations where you can't subsidize completely, you have to ensure that you subsidize family planning completely for this situation so that women can just be able to access it. And if you push it toward the community, it will reduce the need for them to put in resources to look for where the preferred method is. So these are basically things, and I totally agree with you in terms of how important this is, and we'll keep on pushing for that.
Great. Okay, thank you so much, Dr. Sada. I would love to be able to keep going. There were a few more questions in the chat, but I'm gonna, Susan Igris asked a question everyone can see, but let's take that into our next conversation. So let me introduce Deogratias, short for Deo. I mean, we use Deo for short, and Deogratias Yiga, who is the Executive Director of the Impact and Innovations Development Center in Kampala. He is a professional social worker, child rights and protection specialist, and development management consultant with 25 years of experience. And Deo has master's and postgraduate diplomas in development management, master's in social sector planning and management, and a postgrad diploma in children, youth, and development. Deo has been on the forefront of child rights and child protection in Uganda for over 25 years and is working at community, national, and international levels. He provides consulting services in program design monitoring, evaluation, and learning. And his East Africa-based development technical agency is currently leading and partnering with colleagues at the Center for Gender Equity and Health at UC San Diego. And they are supporting collectively the Ministry of Gender, Labor, and Social Development to scale up the Real Fathers Initiative in Northern Uganda. I'm gonna ask Deo to speak, and then Rebecka Lundgren, his colleague, also a longtime member of this resource team, will follow because they are collaborating on this work of scaling up Real Fathers. But I'll introduce Rebecka now too. She is an applied anthropologist who brings the systems approach to scale up to her work in sexual and reproductive health programs. And after a long tenure at the Institute for Reproductive Health of Georgetown, aka IRH, she recently joined the Center for Gender Equity at the University of California, San Diego. And there she continues to collaborate closely with IRH on the Passages Project and in DRC, and is also working, as I said, with Deo and his team and the government of Uganda to scale up Real Fathers. So let us hear from the team, both of them, and then we'll hopefully have some more time for questions, but the time, of course, is always going fast. So Deo, over to you. Thank you so much. And if you can use your video, great.
Thank you, Laura. Okay, let me try to put on the video and hope that the network will be fine.
Great.
Is it clear?
It is, perfect.
Okay. So thank you, Laura, for that kind introduction, and I'm very honored to be part of this fraternity, of this group, this afternoon for me in Uganda and morning for some of you, wherever you are in the world. I've been introduced, so I don't need to go into that. And thank you very much, Laura, for also introducing IIDC and what we are trying to do together with the Center for Gender Equity and Health, University of California. So I will start by moving straight into Rio and what we are trying to do with Rio. Rio is Real Fathers, so we call it Real Fathers, is an intervention. And the word Rio, as it reads, is an abbreviation for responsible, engaged, and loving. So Rio is a proven, effective, and scalable integrated violence prevention approach. It's integrated in the sense that through this intervention, it is being proven that it is possible to address the two issues of violence against women as well as violence against children through the same intervention. Of course, this is also cognizant of the fact that the underlying drivers of these two forms of violence are essentially linked and sometimes the same. So RIO, as I'll keep referring to it, is an initiative that was developed and tested through a partnership between the Institute for Reproductive Health, Georgetown University, as well as already explained, and Save the Children in Uganda. The way it works is that it targets first-time fathers with young children of 0 to 3 years. And the intention is to ensure that these fathers develop loving and caring relationships with both their spouses and their children, so that it diminishes the need to resort to violence in their relationships with their spouses, as well as in their parenting responsibilities. The way it works is that it works through mentorship. And these young fathers, as we call them, are mentored by respected men in the community who are selected by the young fathers themselves and their partners. So the young father and their partner come together and select a mentor from the community. The mentors are, of course, trained on a curriculum, on the intervention curriculum, and deliver this curriculum over a period of 6 months, involving 14 sessions. The whole intervention takes about 7 months. So the curriculum seeks to promote positive child discipline, to promote caregiving, promote gender equity, and to enhance communication between spouses as well as between parents and children. As I said, the young fathers and their spouses and their wives select the mentors, and then the mentors take them through a 14 session, a set of 14 sessions that are designed to reduce child exposure to violence at home, to break the cycle of intergenerational violence, and basically create an environment where positive relationships can thrive. Now, this intervention, as I said, was tested by Save the Children in northern Uganda, in 2 geopolitical regions in Uganda, northern Uganda and the Karamoja region. And the research over a 7-month period proves that RIO can reduce family violence, both in the short as well as in the long term. In an evaluation that was carried out in Karamoja and northern Uganda, it was found that the RIO fathers, basically by RIO fathers, mean fathers that have gone through this program, are significantly less likely to perpetrate interpartner violence after 1 year, and are also much more likely to practice positive parenting more frequently. So all in all, the RIO intervention was tested, was piloted, and was proven to work. But what had not been done this far is to scale it up. So what we are trying to do is to scale up this intervention, to develop a model, a strategy for scale up, both horizontally and vertically. So the horizontal scale up, which is basically geographical, focuses on the 2 regions of northern Uganda and Karamoja, while the vertical scale up focuses on ensuring that this model is integrated within national government policy and programs. It's important to note that as part of the pilot, this intervention was piloted with the input of the subnational government structures, but did not sufficiently involve the national actors and ministries in the pilot. So that is one of the first challenges we needed to address when we talked about vertical scale up, but also horizontal scale up, because now in Uganda, to scale up any program, you need to work and to coordinate with the Ministry of Gender, Labor and Social Development in this case, in case of our intervention. So as part of the scale up, what we're trying to do is our major objective is really to build a constituency that will support the scale up, to identify potential entry points and mechanisms for the integration of real fathers into early childhood development programs in northern Uganda and the Karamoja region. And we hope to do this, and we are doing so through very deliberate and intentional identification and engagement with key relevant actors so that we can enlist their commitment to a systems-based strategic process to the scale up of this initiative. The activities initially planned for this scale up included a mapping exercise of both partners that are implementing male engagement programs and similar programs that are close to Rio, as well as mapping the policies and programs that are in place that are linked to violence against children, parenting, and violence against women, you know, and all other related interventions and programs in this area. The other activity is advocacy workshops, which is also geared at targeting key actors to sensitize them about the model and how it works and to get their buy-in to support the scale up. Then we plan to have a strategy development workshop, working with the key resource team and other key actors to develop a strategy that will enable a systematic scale up. Then we plan for a human design workshop. And of course, we also have some resources to support selected implementing partners or user organizations to roll out these interventions on greater scale in northern Uganda and Karamoja. We plan to do this between January 2020 and June 2021, which is a period of 18 months. What have we done so far? So from when we started in January, we have been, before and after COVID, we have been able to accomplish a number of things. One, we have completed the mapping process, the mapping exercise of both partners and their perceptions of Rio, as well as the policies and programs. And we've also completed the key advocacy workshops with the key actors. We have been able to undertake 4 advocacy meetings with key stakeholders, namely USAID and USAID implementing partners, a second one with the Intraministerial Violence Against Children Committee, as well as the ECD working group within the Ministry of Gender, Labor and Social Development, which is the line ministry. Another advocacy workshop with the Violence Against Children implementing partners in Kampala, which is the capital. And lastly, another workshop with partners in Karamoja and northern Uganda. Now, we were able to do the mapping when the world was still normal, and that was pre-COVID. We had planned to do these workshops through face-to-face interaction in Kampala and in northern Uganda, but then COVID came in. So we've had to do all these 4 advocacy workshops virtually, and this has been quite a learning experience in terms of shifting our own approach and perspectives, and we'll get back to that. What have we achieved so far? What we've been able to achieve is that so far, 8 partners have committed to support the scale up by being user organizations. A total of 16 individuals and key actors, knowledgeable implementers, policy actors, and funders have committed to be part of the resource team. And 5 partners have committed to finance and provide resources, both financial and technical, to mobilize these resources and make them available to adapt RIO within their ongoing programs. Of course, there are a number of stakeholders that are yet to be fully convinced, and that was really expected, especially when it comes to how we're going to integrate RIO into the policy framework. So that is work ongoing. So going to the real focus of this discussion, what are we learning and what are the major shifts that we've had to go through as we try to roll out this scale up? The first shift is not linked to COVID. The first shift is linked to our own learning as we went through the scale up. Of course, we had planned to work very closely with the government in this scale up, obviously, as a partner, but also as a target of our engagement. But through the consultation and reflection on our part as the NGO partners, we realized that we needed to move away from working with the government merely as a partner and a target to working with the government as the lead actor in the process. And we had to use all networks and opportunities and spaces available to convince, first of all, the key ministry actors, including the lead managers in the Ministry of Gender and Social Development, about the efficacy of this initiative and the value of scaling it up. And we were able to get their buy-in, and we surrendered the leadership of the scale-up process to the government. And as we speak now, all the activities we've been able to do, the advocacy workshops, have been led, convened by the government. And this has made a huge difference in terms of the response of the different stakeholders, the enthusiasm, the interest, and their commitment. So this was a major shift for us because, yes, we had planned to work with the government, but not in the way we have now worked with them. Of course, it has its challenges, but it has proved to be the game changer in this scale-up process. The second shift is, of course, working virtually. We had planned to undertake most of these activities physically, and we have had, apart from the mapping, all these actual engagements, the workshops, and the meetings, we've had to do them virtually. That meant that we had to reduce, a full day workshop to a 2 hours engagement on a virtual platform. And it has worked, So we've had to learn a lot in terms of adjusting our content, our method, prioritizing what we want to focus on, and it has worked quite well, surprisingly. The third shift is that with the COVID situation and the social distancing guidelines and the need to use virtual platforms, we realized that we had an opportunity to involve a much wider and diverse group of actors than we would have been able to do within the limits of the budget for face-to-face meetings. And so we've been more open and we've been more flexible to involve many, many more actors than would have been involved initially. So these are the major shifts that have brought a whole new dimension to this, scale-up process. Of course, moving forward, we still have a couple of workshops that we want to do, basically the strategy workshop and the human design workshops, which we still also intend to do virtually. And Rebecka will talk about the challenges and the plans around this in a short while. Then we are also evaluating the community activities, because when we talk about RIO, I talked about the actual engagements that have to happen, the engagements that involve the fathers, the young fathers. Now we need to evaluate whether these activities and all the activities that are actually involved in the actual rollout of the intervention can be done within the context of the social distancing. And to the extent that that is possible, we try to innovate and see what we can do within the current context. What are the major learnings that we have as I conclude this part? One of the key learnings is that consultation and flexibility are key, especially at the planning stage. We are lucky that we are working in a very flexible way in this partnership, and that also I think our donor gives us the space to be, flexible in the way we do things. And so we were able to shift things around to accommodate more government involvement, to change budgets to the extent possible, which became necessary because of the new way that we had to work and the new environment in which we were working. So flexibility is the key, especially in this context. And if you have a very fixed way design that you can't quickly change, then it's going to be very difficult. Then, of course, I can't overemphasize the importance of working respectfully and, you know, collaboratively with government and accepting leadership from government. Because by doing this, you already almost attain part of the objective of the scale up. It has its challenges because you have to work according to their schedules. You have to, you know, to work much harder. You have to accommodate government. You can't move as fast as you wanted, but in the final analysis, you know, you get a much better result. Then thirdly, we were very skeptical about working virtually, but we've learned that if you really organized and well planned, it is actually possible to achieve results working virtually. We're very nervous, especially regarding our engagement with the field-based people in Karamoja in northern Uganda, partners who are working on the ground, and their versatility around IT and technology. But what we are finding is the last workshop we did is that people are really catching up. People are tuned to work this way. And we had a very successful workshop with grassroots actors virtually. So people, you know, sometimes we tend to underestimate what is possible and what grassroots actors are able to do. But I think in the virtual world, they are really catching up fast. Of course, lastly, I think working virtually has its limits and challenges. We miss a lot of the dynamic that would be in the face-to-face meetings. We need to think about changing methods, content, timing. But this is ongoing work, and it is the real challenge for us to be innovative, to be creative, to ensure that the work, the scale-up can go on in a different context. I'll leave it at that and invite Dr. Rebecka to pick it up from there. Thank you.
Yes, Deo, thank you for highlighting those opportunities and constraints. Rebecka, can you continue for just a few more minutes?
Yeah, I just wanted to thank you, Deo. That was such a great overview. I just wanted to touch on a few sort of the really practical lessons and the process that you know, we've gone through together and that Deo's team has led. So one thing I wanted to remark is that, kind of echoing what Dr. Sada said, that there seems to be like an amazing motivation and openness of everyone to work together, to work online, to look for cross-sector engagement. So I think that's a difference that I'm seeing post-COVID. And in this particular case, there's a strong identified need of work against violence. So that's really, I think, facilitated our work. I think, so all of the meetings, after the summer, a few of the individual advocacy meetings and the mapping have been online. So they've all been using the Zoom platform. And we found, although we were nervous initially, a lot of advantages to that. So one thing is it's helpful for people to be able to note key points, to see their screen, use of sort of the chat box to really engage people through, they can share questions, you know, but also, like, I've been able to be online as a technical backstop answering questions throughout the meeting as we went, so people didn't have to wait to get their questions answered at the end. Really excited about the broad engagement of people that we never would have had if these had been online meetings. So we've, some of the tips that, you know, definitely keep the Zoom meetings or the online, whatever platform you're using, to less than 2 hours. We're kind of working on finding the right balance between low doses over a long period of time. So, you know, meetings every week or every 3 days versus, you know, people kind of clustering together with more time. Really strategic use of pre-reading. So what are you going to send out ahead of time? For example, try not to go over too many updates on the calls. Doing, as I think Dr. Sada maybe, or Deo also said, a lot more prep in the background is needed. Use of breakout rooms, really need for a lot more engaging visuals on the calls to keep people's attention. I think a couple times we've used video as a backup. So speaking sort of personally from my point of view as providing technical assistance, it's been quite a difference, you know, rather than going to a country and just being all in for a week and, you know, doing everything, then we've had to really space this out, keeping the balls in the air over time has been different as you're sort of chunking out the technical assistance. And most of the meetings, of course, are around like midnight my time. So occasionally IDC has used little videos, as a backup in case someone's Zoom wasn't working or we couldn't get online. I also record. It's a great opportunity to be able to record what's going on in these meetings and share them to people who couldn't attend. So I think overall, a lot of advantages to working online. And as we're planning the 9-step strategy, which some of you are aware of, it's like a set of exercises. We're just chunking them into 4 or 5 sessions with some pre-work, some post-work. And I think we're really excited about the opportunity that's going to give us to connect with people in between, to get the notes in order, to build on it, to have a really exclusive group. So I think, in some ways, using a Google document to really record what we're deciding as we're developing this strategy document and then moving it forward, I think is going to work really well, but we haven't tried it yet. So, we'll have to let you know about that. I think maybe the only other thing I wanted to talk a little bit about the challenges. So one of the challenges we found is that as you're getting to the end of the Zoom call, you're getting to the most important part. You're getting to the commitments, you're getting to the wrap up, you're getting to the next steps. And often you run out of time at that point. So it's really important to follow the call really carefully, keep to the timing really carefully so that you don't have to end the call before you get to the, people basically closing the deal and, making sure that we know what the next steps is. The other challenge has really been, I think, sort of the networking, the developing, the esprit de corps. It's possible, but it's a little bit more difficult. So we've experimented having like virtual drop-in times when people can just call in and get to know each other. And linked to that is how to motivate people. Because, typically you have these workshops, people get per diem, people come to, get a little break, they go to a great place, you get some good food. So, how can we motivate people in a different way when we're not bringing people together closely? I guess the other I would just like to say that I think, whether it can be a little harder to get sort of like positive feedback from the, from the people that you're working with when you're online, but a little bit of connecting goes a long way, even if it's just chatting in the, in the chat box or seeing people's video. On that call that Deo mentioned in Northern Uganda, I saw people we hadn't seen for 6 years who were involved in Real Fathers and other programs. And, just that sort of personal energy that was going on in the chat box and on a Zoom a little bit was really motivating, I think. So overall, I guess I'm really excited about sort of as we get more and more sophisticated about working online and connecting this way, because I think it does really open the ability to include more people, to be a little more democratic about who's speaking and who's involved, and to really kind of carefully document and build on the work of each meeting you have so that, and everyone has a chance, for example, after the meeting to go on to the document and review it and update it. So maybe I'll leave it there.
Great. I am now wishing we had scheduled this as a 2-hour meeting like you're limiting us to, Rebecca. I think those are very wise pieces of advice for everybody. And I thank you for them, both of you. There are some wonderful questions and comments in the chat. And given the time, we're not going to be able to address them all. So one of the interesting, most recent questions came from Amy Ragsdale about asking you, Deo, I think, and Rebecca, how have you decided when in program development, design versus pilot, to involve each level of government? And I know, Deo, you shared some thoughts about that perhaps you started with the national level a bit late, but this is an important question. It's hard to balance that participation and figuring out when. So if anyone wants to share about that, that would be great. Deo.
Thank you. I'll ask Rebecca to, thank you. I'll ask Rebecca to talk about the government involvement in the design, and then I'll talk about the government involvement in the scale up.
Yeah, so government involvement in the design, that was, so as you mentioned, Dale, this was a pilot and it was conducted in Northern Uganda and Karamoja. So there was a lot of government involvement from the north, right? So district officers, there was plenty of engagement at that level. In fact, they were the trainers. But we always struggled in our work, and I know some people on the call who were part of this work, in getting the national level engaged. So partially because of the difference, the travel, the costs, et cetera, and partially because at that time when this was going on, the sort of interest and focus on violence, I think, and violence against children was much more nascent, I think. So I'm not sure it was really seen as such a big priority as it is now.
Go ahead, Dale.
Okay, so I think the assumption also implicit in the approach is that when you engage government at the lower level, that information will flow to the national level. And so it would have been assumed probably that by working with the government structures that are closest to the intervention in the design, this information and this awareness will, stream up to the national level, but that doesn't happen quite well. So when we came to the scale up, it was a bit of a challenge in the sense that the national level actors were not aware of the intervention. Maybe those who knew about it had moved on, but the team that is in place now didn't know about the intervention. And practically, the first step is to ensure that they have a good understanding of the intervention and that it makes sense to them and that they are willing to be part of the process. And so you have to put everything on the table, what you intend to do, what resources you have, how you want to work. And these are some of the challenges that sometimes come with working with government. But, and of course, it takes sometimes a bit of, connections and knowledge and partnerships, pre-existing partnerships with government. But I think in the final analysis, both in the design and in the scale up, involving government early is important. As has been highlighted, it's extremely important that you move with government, because you can't talk about scale up, both horizontal and vertically, without the blessing and support of the government.
Yeah, thank you, Deo. So we only have 4 minutes left. I'm going to ask Elida to pop up the full results of the poll, because I think that from what everybody has been sharing, Dr. Sada, Deo, Rebecca, and Martha and others who've weighed in with questions in the chat and everywhere, that we're seeing a lot of this become borne out in the experience that was shared today, where people both feel like in the first question that their work has slowed, but that they're proceeding still, and that there is some level of confidence that people are able to meet their goals. Some people, it sounds like, are not very confident, which is worrisome, but I can imagine that there are ways that people are adjusting their goals, and hopefully someone asked a question about funders and what the level of funder support is, which I had hoped to ask more of myself. But this last question about benefits, I think, is really what we heard a lot about today from the speakers, where there clearly are some benefits to being able to meet online with people that are otherwise very far away and have difficult time getting from Karamoja, for example, to Kampala for a meeting. So you have to have fewer of them. Whereas we were hearing from Deo and Rebecca that there is this ability to involve more people that otherwise we wouldn't. And I myself am experiencing some of that as well. So I regret that we didn't have more time for experience sharing with the resource team, but would anybody like to weigh in with a comment at this stage, quick rapid fire comments of learnings that you have? Please go ahead and just chime in. Anyone? You have to unmute, don't forget to unmute.
Continue the discussion. Continue, have another round of this, because I think people have lots of things to say.
Okay, so yeah, good idea. Sorry, was someone else gonna say something? We can do that for sure, Martha, thank you.
So I can respond to a question or two
Please.
that I've seen.
Go ahead, Dr. Sada.
Yes, so I sort of have two questions, which I think one of them relate to institutionalization of the process, or more like institutional institutionalization on a sustainable basis, which I think Ramadan asked. Just to say that for us, what we look at is, we have what we call the 3 C's. So what we look at is that there are a lot of frameworks that support institutionalization, but whether that institutionalization is going to be sustainable is another thing. And we come up with some 3 C's that we think are likely to ensure that institutionalization remains and is more sustainable. One of them is if there is competence of the government workers, all the processes that has been institutionalized, they are part of it and they are quite competent in doing that. And we look at not just the technical competence, but also in terms of the competence in the process. We also think that there is, there is a need for some connectivity with the community and with whoever they are serving. If there is that kind of connectivity, they are more likely to adapt the process continuously without even looking at the fact that this is anything. But we also think that there is a need for them to be more committed. And that is part of what we try to instill in the consultative decision-making. So we have a very big write-off which is supported by a lot of data and a lot of literature of this process. But this is just in terms of the summary.
Yeah.
Now, for the other question, which asks about what advice do you have for funders? I think I will have just 2. One thing that we keep on seeing is the fact that there are some issues that matter, but usually on a normal situation, they slip through the cracks, but you always come back and get them off and push for them. In the COVID situation where implementing partners are not as engaged, especially for those that are doing capacity building of government, when we don't meet physically with the government, there is a need to ensure that issues like gender, issues like right-based approach, they are really emphasized, because with the situation that is happening in homes, with the lack of resources, this tend to suffer significantly in families. And if you don't focus a lot on it, you will be missing that magnitude. So these are just key things that I wanted to say. One other thing, in terms of the donors is obviously there need to be a little bit more open with less getting together. A lot more people are needed to be able to make sure things are moving in terms of implementation. So a lot of emphasis will have to go to how much goes into people, how much go into personnel as against the others. Perhaps some percentages may have to be, donors may have to be a bit more open to it. Some equipment might also come that ordinarily they may not be funded. And the timeline will also have to be a little bit stretched out, so need to be a bit more open to that is also important. So just in summary, these are the key things I thought about.
Thank you, Dr. Sada. And let me also thank all of our speakers today and for the preparations and participation. I know it's a complicated time to dedicate 90 minutes. We appreciate it, and we hope that you will join us for the next quarterly meeting, which will likely be in September. We can give you updates about the progress on the COP leadership at that time. And if anyone would like to be added to the listserv, as Elida was saying, please re-add yourself as is needed in the new transition that we're undergoing. So please, everybody, thank you and continue to take care. Precautions, everybody, and stay safe and well. We need you. And thank you so much for the time. Goodbye, everyone.
Goodbye.
Bye. Thank you.